and we'll be speaking last about Malaysia. This is very, very different. Andrea was very in-depth and precise. This is incredibly rough and ready overview, bird's-eye overview, lots of different pieces of research that are going on in Nepal. I'm just speaking because there's only 15 minutes, otherwise we would have done a double act with Dr. Pramod Ragmi, who's lecturer in international health, and our colleague who hasn't arrived yet, Nepal Aryan. Over the last 10 years, we've been working in Nepal on different projects, health-related, maternity care, mental health, media, migration, and we've had a number of PhD students. 3 of them have finished. Jip just recently finished. Priti is nearly finished, and Raksha has just started a month ago. So I'll start with a little bit about mental health. So this was a funded project from TED, the Tropical Higher Education Trust, which we worked together with Liverpool John Moores, Tribhuvan University, and a number of small organizations, Kritara, in Nepal. And this was really, so it's really a practice training-based intervention, which is why we got the money, and we put an evaluation part on it to make it research for us. So we trained low-level community-based maternity healthcare workers, lower than midwives, lower than nurses, who are the key healthcare providers in terms of everything, including maternity care. And it started from a review article we did a couple of years before about the high number of suicides in women in Nepal. And if you know a bit about suicide, it's mainly men in Western countries, high-income countries, so it's very different. And that's one of our visiting faculties doing the training in Nepal. So there's just going to be 1 or 2 slides each on each of those, just to give you a range. This is Priti, top right-hand corner. She just published a paper, it's not quite out yet, on the training. So we did the training with volunteers, and it's at midwives, and it has mental health nurses, health promoters, and then Priti came along as an outsider, not having been involved in the training, and did her PhD as part of the evaluation. So these are 2 papers just published in the last month by her. I'm just highlighting, it's literally sort of a snapshot. So our previous student, Sheetal, also worked on maternity care in a different project in a different part of Nepal. She graduated last year, so she finished her PhD just about a year before. Mixed method studies, qualitative and quantitative, quite big data sets, and she published, I think she published 7 papers from her PhD. And I think this is the best one in terms of quality, plus one. I'm pretty sure Nora will submit that to the rest under her name. We are really interested in health promotion, coming from a health promotion empowerment kind of background rather than a more general public health in that we away from a much more medical approach. So we've written quite a lot about health promotion and different aspects of health promotion related to work in Nepal. This is our latest graduate, so Chip finished this year, we're graduating in November. His projects, supervised by Jane Murphy and Martin Hind and myself, was on parents of young children and their attitudes and knowledge of healthy eating. So these are extremely poor parents in and around the second city of Nepal, and he's got 2 papers published, so 3 papers published so far, I think. We've also had midwives, midwifery lecturers working on a project. We had some money from the Royal College of Midwives, with Leslie Milne, got to look at staff perceptions and barriers towards women coming for birthing service, maternity care services in 2 non-governmental hospitals. Again, published a paper out about the use of pregnancy and health, and we wrote a commentary before that on the notion that Nepal needs midwifery. At the moment, midwifery is not a recognized profession, not recognized separately from nursing. and we've been working with MIDSIN, the midwifery organization of Nepal, trying to improve the status of midwifery in the country. We've done some papers about ethics, some specifically about Nepal, some more general about the importance of applying for ethical approval and having ethical approval in research that is in developing low-income countries. That's the top right-hand side, and then we've done quite a few editorials. One of our hobbies is to write articles, and one of the easiest way of doing that is to write editorials. And the really easy way of writing editorials is English language journals in developing countries, because people are desperate for outside information. They're desperate for people who can write proper English rather than Nepali English or Indian English or Bangladeshi English. So we'll have an editorial a month at the moment on aspects of healthcare. So one with promote here local elections. Which were the first local elections in 20 years in Nepal. That were 2017, 2017, and into issues about the new constitution. Nepal kicked out the king in 2006, became a constitution, parliamentary democracy, a new constitution, and the constitution took 3.5 years to get together, with lots of political debate, and again, we've written about the aspects of potential effects of that in the country. We've done some work on Nepalis living in the UK, working with the UK Nepal Friendship Society. The report that was published 2-3 years ago now, 2015. And we had a lovely letter in the Lancet, was quite widely quoted, about mental health, about black and minority ethnic groups and diabetes. Again, we promote as the first author. And we have applied for 2 other grants, but unfortunately not been successful to work on aspects of either mental health or diabetes on ethnic minorities in the UK. And the last 3 years, 4 years, we've been working on migration, specifically about health aspects of migration. Got quite a few papers out at the moment, quite a few research projects ongoing. Pratik Adhikari, who was the first student from Nepal to graduate with a PhD here, his work was on health workers, on the health of migrant workers in Malaysia and the Middle East. 2 or 3 publications from that. We've worked with a charity in Nepal that rescued women, supports women who've been trafficked. Pauruki, we had a paper on female migrant workers with them, and we've got a couple of projects ongoing, including a project looking at Nepali migrant workers in India, and project on looking at support before people go out to work in other countries from Nepal, and a project on those left behind. So mainly women, 90% of the migrant workers are men in Nepal, which is also very different from the global figures. Global figures is about 50-50 men and women. Migrant workers in Nepal are mainly men, mainly going to very demanding, unskilled, high-risk jobs in building sites, agriculture, and manufacturing. And then to round up with a couple of wider aspects that are not necessarily related to individual studies. There's on the I think it's London School of Economics, but it might be Imperial College. They've got a website with blogs about My Perfect Country. There's 4 or 5 different countries when we looked at it, and we said, oh, well, we need to write something about Nepal. So we wrote, my colleague Panam Simkala from Liverpool Moors, about maternity care in Nepal. We've written editorials about sexual health and sexual minorities. We organized, this is on the next slide, the education conference earlier this year in Kathmandu. We were one of the co-organizers, and Steve T came out and talked. And at the same time, we signed a memorandum of understanding with Manuel Memorial Institute of Health Sciences, with whom we've been working for about 10 years. I've been visiting professor there for 9. And we've written about aspects around, for example, the earthquake, in a sense of opportunistic kind of way, but the earthquake occurred in 2015. There is a British Nepal Academic Council which runs for and by academics in the UK, and we ran the conference in 2017. This year it was in Durham. It's at a different university every year before in Liverpool. I like this picture because this is Steve T with his bodyguard. That's the Prime Minister of Nepal speaking at the conference. And the last one to show off, we published a book on health care and health dynamics in Nepal 3 years ago now. And then this is the last slide to give Jonathan some time to talk about Malaysia. About some of the media coverage, we've got quite a lot of media coverage in the English language newspapers in Nepal, but also on websites. This is a Oxford-based charity that helps developing countries with publishing, and they picked up one of our articles and wrote about it. We've been in the Mail Online, and this particular article, short article, Ms. Nirmal was the first author, was published in about 20 countries, in about 40-50 newspapers, including the New York Post, the New York Times, the major journals, major newspapers in New Zealand, and UK, the Netherlands, India. So quite a lot of coverage from a very short and relatively minor article. Just a newspaper journalist picked it up from Associated Press. That's it really, just a really quick bird's eye overview, just to give you a sense of what's going on in the faculty. And then as last advert, the advert for the Festival of Learning, if I remember well, the 20-something of June. It's in the book, and we'll be talking about health and migration in Promotanai in much